Our next speaker is Associate Professor Kerryn Pike. She's a clinical neuropsychologist who has extensive experience in understanding and managing risk factors for cognitive decline in older age and in getting the best out of your thinking and memory at any age. Dr. Pike is going to talk to us today about strategies to manage memory and thinking difficulty after brain surgery, which I think will be really pertinent after our conversation this morning. Please welcome Dr. Pike. Thank you.
All right. Okay, so I've just got my phone with me to keep myself on time because anyway, hopefully we stick to the 15-20 minutes. All right, so I'm Kerryn, so I'm one of these rare clinical neuropsychologists that don't exist, and I'll be talking to you a little bit, and I think I changed, let's see, is this moving along? Yep. Should just be one click. There we go. All right, I actually changed it a little bit, so I'm not just going to talk about strategies in managing memory and thinking difficulties after brain surgery, but after brain cancer in general. So whether or not you've had surgery, there might be some changes with your memory and thinking, and we'll talk about that a bit in general. So as I said, I'm a clinical neuropsychologist. I've worked in this area for about 15, 20 years. I'm particularly interested, so of course neuropsychologists do assessment of people's memory and thinking and cognition and what's going on, but some of us, and I do, also do interventions about how can we improve memory and thinking in everyday life, and that's really my passion, about how do we make things better for people with whatever everyday difficulties you're experiencing. How do we work around what's going on and improve quality of life? That's where I'm particularly interested, and that's kind of what I'm going to talk with you about. And again, I just have to say next slide, or can I?
Yeah.
Yep, cool.
It should be working.
Should be working. Yeah. Does not want to work for me. Should just be forward click, yeah?
Yeah.
No. Okay. All right, so just a little bit of background. So cognitive changes. So cognitive's just talking about memory and thinking. They're really common for people after brain cancer. Something like 90% of people. So 9 out of 10, almost everybody reports some sort of changes in their memory and thinking. And there can be a whole heap of different types of things that might change. So, you know, how quickly your thinking works, your attention, how long you can focus on something for, how good your ability is to switch your attention from one task to another or avoid getting distracted when you're doing something, your ability to multitask, like do more than one thing at once, planning an organisation, your memory, remembering things that have happened when you want them. There can be impact in language and communication, so saying what you want to say, getting the words out that you want, and sometimes in understanding what other people are saying. And also I've put behaviour there. I'm not really going to talk about behaviour, but obviously that's another huge area as well that can change for people. And these are really important because they impact people's quality of life, what you can do. If people want to go back to work for a bit, you might find that your capacity's changed. I know someone, I think Cassandra, you were talking about that before, you want to go back to work and you sort of want to know where your capacity's at. Are you going to be able to do the things you used to be able to do? Can also impact, things that are happening in your daily life and so forth. So I think this is an important area for us to think about. And I can't click forward again. Next slide, please. Thank you. All right. So I just thought, here's the brain. That we'd think a little bit that the changes that you might see following brain cancer will be quite varied for any individual person, and a lot of this is to do with where the tumour was in your brain and where the treatment has affected in your brain. So, where surgery might have had to go, where you've got radiotherapy, that sort of thing. If we go to the next slide. So back in that other slide, you can see there's 4 sort of main sections of the neocortex, the big outer bit of the brain. There's obviously lots of other bits inside, but the main bits for cognition are all on the outside, so we'll sort of focus on them. And so you've got these different lobes. So you've got the frontal lobe, which takes up that front third of your brain back to here, all this bit. And that's involved in all these sorts of things, lots to do with your planning and organisation, problem solving, that switching between different tasks and so forth. So, if anything's happened with your frontal lobe, these are some of the
Try to
symptoms.
be on the microphone.
Oh,
just on the microphone.
This microphone. Okay, sorry for the webinar. We'll go. You can also get some of the behavioural symptoms will come after injury to the frontal lobe of the brain. The parietal lobes, the bit just behind the frontal lobe, sort of there, and that's involved with visuospatial navigation, finding your way around. You might find it more difficult, might be more likely to get lost. It's involved with integrating all your different sensory information, working with numbers and some language processing and comprehension. So we go on the next slide. The temporal lobe, so that's the bit that's near the temporal part of your temporal bones, near your ears and so forth. So that's really involved in memory, creating and forming new memories. It's also involved in understanding, processing language, auditory and visual processing, that kind of thing. The occipital lobe's right near the back of your brain. That's all to do with vision, so you can get some different sorts of vision symptoms depending what's impacted there. And then you've got your cerebellum, which is mostly thought to be involved with coordinating movement, but might actually have some role in some other bits of cognition as well. So, you don't need to know all of this, right? But you get that people might have quite different symptoms depending on which bits of the brain have been impacted to start off with. Okay, so next slide. So what do we think, and this could be a little bit of a brainstorm if anyone's got some ideas, what are some of your reasons for cognitive difficulties after brain cancer? Yep, so surgical side effects. Yep, good one. Drugs, yep, so lots of medications can impact on your memory and thinking. Fatigue, it's a good one. Emotion, yep, so they're dealing with the whole, facing that you've got brain cancer and stress and anxiety takes up a lot of capacity of your brain, that then there's less available for other things. If we pop on the next slide, we'll see, we came up with some of these ideas. So there's a lot of things that impact on your thinking and cognition after brain cancer. So it's no wonder most people find some difficulties. And you can sort of work through with any individual person thinking about which of these might be impacting you at this time and which of these things we might be able to shift a little bit. So, some of these things you can't really change. If you've had brain cancer and you've had surgery, that's done whatever that's done. But things like managing stress and anxiety and fear, we can work on that. You can manage that to reduce the impact that that's having on you. You can manage things like if you're having a lot of sensory overload, you can manage that in your daily life to reduce that impact. You can manage, like fatigue can be managed and then have less of an impact on your cognition. So it's sort of worthwhile thinking about all these different things that might be happening and which ones are having the biggest impact on you at this sort of time. Okay, next slide. So what can be done? All right, so that's all the background. It's probably like, so, yeah, we know this, we're sort of experiencing this. What can we do? So, there's no one answer. It's about a range of strategies. So it's a very personalised thing about working out for the person what's going on for them, what's their biggest issues they're facing, what are their goals, and then trying to think about how we're going to work around that. And thinking about why is this problem occurring, and then looking at that page before, what's the impact of all these different things, which ones can we work with? So, for example, I guess some common kind of cognitive complaints might be about difficulty remembering the new names. Maybe you're trying to learn the names of your new OT or one of your therapists and you're having trouble with that. So that could be a particular goal that I want to work on this, what's going on, and we can think about that. Or it might be, a goal around not forgetting where you put your mobile phone. So actually, mobile phone's not a great one because there's a really easy solution there. Just ring it and find it. Maybe your glasses. That was my one that I was going to say. Where if you put your sunglasses. So you always spend all this time running around the house, missing your sunglasses. Where have you done them? So little tasks like that and goals we work on and try and improve those to improve everyday life. So next slide. Yeah. So some of the things we do is think about the person and the things that are coming in with them, and then thinking about what we know about cognition and how it works. So if we're thinking about those memory problems, one type of problem, one of the important things is understanding actually how memory works. And it's not like we've got a video camera and we don't go around and just record everything that's happening in our life and it's there for us to recall. What actually happens is we've got to take the information in to start off with, so we've got to register the information. So if you think about the example with the sunglasses, did you actually pay, when you rushed in from, you were driving home wearing your sunglasses, you rushed into the house, you put them down somewhere, did you pay any attention to what you were doing at that stage, or were you caught up and you put the groceries away and you did something else, and then the next day when you want your sunglasses, you can't find them? And so if you think about that, that's actually a problem in your registering information. It was actually about attention. It's not so much about your storage of it, yeah? The next step then is storage. So sometimes you have paid attention to something, but it's actually your memory system's not working properly and you just can't remember where you put it. The information went in, but it's dropped out. And then on the next slide, there should be the last stage for memory, is that you've got to be able to pull that information out and use it again when you need it. So when you want your sunglasses the next day, you may have paid attention and you may have stored it, but you just can't get that information back out. So there's sort of these three basic processes of memory that if you understand that, you can start thinking a little bit more about what might be going on in any one situation. So I'll go next slide. So it's helpful to think about this. Oh yeah, okay, so what affects encoding? So I might go into the next one. So getting information in, there's a bunch of things that affect that. You know, if you're paying attention. So, I'm putting the sunglasses on top of the microwave, I'll remember that. If you're interested in the information, if it's new, if you've got prior knowledge about it, if it builds on something you already know, how emotionally valent it is. So if it's with strong emotions, so we normally remember stuff better that's either, you know, was a really exciting, happy moment, or things that were a more devastating moment. Those things stick in our head better than just everyday kind of what you ate for breakfast type thing. Your well-being will impact it. So if you're feeling a lot of stress, grief, that kind of thing, you're not encoding stuff as well as normal. And how much processing you do. So if we go to the next slide, I think that explains a bit. So in terms of processing, this is like strategies, things you will do to try and get that information into memory. So things like, I can't go away from the mic, writing information down. So just writing it down helps it get into your memory. Creating associations. So thinking about the sunglasses on top of the microwave, you might visualise that. Thinking about remembering your OT's name. Maybe she's got red hair and her name's Rachel. Maybe you always think of her as redhead Rachel. That helps that stick in your brain. Yeah. Trying to learn less information, saying stuff aloud, reducing distractions and kind of being aware that this is a moment that I need to pay attention. So next slide, I think, talks about storage. So if you identify that the issue is more about stuff sticking once it gets into memory, then this is really impacted by how often you bring the information back to mind. So the more we think about something, the more we use something, then actually it sticks better in our memory. And so really that's the technique you can use there, is bring stuff back to mind. So with your OT's name, when she introduced herself, oh, nice to meet you, Rachel. And then you might use her name, Rachel, again in conversation. And you might be talking about it with your family later and mention how her name was Rachel. So you keep using that information and bringing it back to mind, and that's helping store it in your memory. And then the next one should be about things to help with retrieval. So retrieval is impacted by, do you have good associations to help you find that information in your brain? It can be impacted by the speed of thinking, like how long it takes you just to find that information, and how much pressure you're under. Are you up giving a lecture in front of people and you can't find the word you want right now? Or can you sort of say, it doesn't matter, I'll just talk my way around it? So they're the main things that impact that retrieval of information. And so some of it can be improved by creating cues when you learn it. So red-haired Rachel, oh yeah, that's right, something to do with her red, it's something starting with R, that helps bring that information back. Trying to think of other associations. So with Rachel, you might think, it sort of ended in Chell, was it Michelle, was it something, and that might help it come back. Reducing the pressure to say, it doesn't matter, it'll come back if I stop thinking about it. And managing your well-being, try not to be too stressed and things like that as best you can. Okay, so that's sort of a little bit of a snapshot of what we do with some models of memory and cognition, to think about how you break it down and look at where someone's having a particular difficulty for a particular thing. So on the next slide, what have I got here? Oh yeah, I just thought I'd throw a few in without going through the whole process, but a few strategies for people. So you had things to take away of what kinds of things we'd suggest. So if someone's experiencing slower processing with their thinking, so one of the big things to think about is that really often causes people a lot of fatigue. It's more effortful every time they're trying to take any information in. It's slower, it's more effortful, and then they get more tired. So you need to think about that. And so then, give yourself time and so forth. But letting time to process information, asking other people to slow down, to repeat the information, asking your doctors and health professionals, can they write down the important points at the end of your consult so you can take that home and go over it again? For doctors, suggesting, or health professionals, they provide handouts to people routinely. Writing information down, repeating it back, breaking it down into bite-sized chunks, not complex chunks. And, if you're studying or working, that kind of thing, getting accommodations so that you get the extra time that you need to do exams and assignments and that sort of thing. Okay, next slide. I think on the next one's got some strategies about attention. So similar things, and these of course are similar in that first process of memory. You know, if you've got difficulty with attention, just try not to take too much information at once. There's a limit, and so you only want to take that limited amount in at once and not try to overload, because it's just not going to work. That's not how attention works. Try not to multitask. Just focus on one thing, get that finished, and then move on to the next task. Setting things up, like knowing that you've got difficulty with attention, and then just setting things up to have less distractions. So not having the TV on in the background, you know, asking people to be quiet if you need to make a phone call, reducing clutter, so auditory attention, like things that are going there, but also clutter in your space and so forth is important. Removing apps from your phone that might distract you and take you off somewhere that you didn't want to actually be. Breaking things down into small chunks and being able to tick that off as you go helps you kind of keep your attention and focus. So there's some sort of, you know, throwaway but ideas that can help people with attention. Okay, what's on the next slide? Okay, all right. To sort of finish up, so it's a very brief tour in 20 minutes to try and go, how do you work with memory and cognition? We're actually, so as I said, we've done this for a while. We're actually doing a research study right now. We've just got ethics and we've got one person recruited, so we're about to start running this study, which is a memory management group. And it's specifically for people after brain cancer, and it's specifically to work on difficulties with your memory and thinking post-brain cancer. So it's going to be a 6-week program run on Zoom with other people with brain cancer who've got concerns about their memory and thinking. And it'll work through information about why these problems talk, so a little bit about what we did today, but in 12 hours instead of 20 minutes, and think about, you know, particular problems people are having and what sorts of strategies and things might help, and working with, you know, trying these strategies out in your life and coming back and talking to the facilitators about how that worked, what didn't work, that kind of thing. So that's sort of happening now, so if you're interested, you know, talk to me about more information, you can follow up there. I think the last 2 slides is just, the last slide's just some resources that can be really helpful in this area about cognition. I think that's it. Great.
Thank you very much. That's all right, Marina.